Well, good afternoon, everyone. My name is Sharif Madavi. I'd like to welcome you to our March 7th Modern Vision Correction webinar. We will have a great time over the next 30 minutes as you will get to hear our surgeons answer the most common questions that people ask when they're considering either LASIK or the EVO ICL or custom lens replacement CLR. And what you see here on our welcome screen are some of the famous people that have been treated. Many of you have heard of Greg Papa. He is the radio announcer for the 49ers and has a weekly show on KNBR. And he's had custom lens replacement. And then you see Cameron Brink here, who was a star basketball player at Stanford, now in the WNBA, and you might have seen her on commercials on TV. Her star is rising in the celebrity world. But today we're going to talk about you and what your needs are, and whether you are a famous, well-known person or an adventurer here like Yoel, who is one of our patients who does all sorts of outdoor high adventure sports, or just like the rest of us who are patients who are having trouble seeing and would like to explore a solution for that. We have something to offer you. And here's just a quick video clip of a patient that was recently treated, and her husband is waiting for her right after CLR. Oops. And that didn't play. So let me go back. There we go. Hopefully that plays. So Christine, how was that for you?
That's so easy. Very, very easy. Simple. Felt nothing very fun. It's a great one.
In the middle here, come on.
Yeah, let's get a little.
We're gonna have this forever.
All right, awesome.
Okay.
Well, thank you for letting us take care of you, Christine. We're going to see you tomorrow morning.
Yes.
We'll see you tomorrow morning.
Okay, absolutely, Doc.
All right, you take care. Thank you.
God bless.
You know, that's just one example of what we get to do every day in terms of helping patients see better. And today on our webinar, and this will last about 30 minutes, you're going to learn what is modern vision correction in the first place. How do we characterize that? We'll help you understand if you're a candidate and maybe which of the procedures we offer might be best for you. We'll talk about recovery, side effects, and we'll talk about cost and whether or not it's covered by insurance. But with that, I'd like to welcome Dr. Craig Bindi. Dr. Bindi, thanks so much for being with us and taking time. I know you're in between a busy morning and a busy afternoon of surgery. So
yeah,
welcome.
I'm 100% here, ready to go. And Sharif, thank you for kicking that off. And to everybody out there, well, welcome. You know, thanks for taking time out of your day. Happy Friday. And today, I think people will learn a lot. People have a lot of questions sometimes before they come in for a consultation, wondering, are they a candidate for procedure? Is it something they want to pursue? And this is just something that is a good starting point to see if it's something that might be a good fit for you. And first of all, just the concept here is just the thought in 2025, it's not too far-fetched to be able to wake up in the morning and not fumble around on the nightstand looking for your glasses just to start your day, or to be able to drive to a restaurant and then once you get there, also read the menu, or sit on your couch and watch TV and look at your cell phone. Just think of all the normal stuff that we all do every single day. And the thought here is so you can just do it, but no glasses, no contacts, no readers, no bifocals. And so I guess the broader topic today is just so you can learn more about what we call modern vision correction. That's kind of an all-inclusive term for the types of procedures we do. It includes laser treatments. People have heard of LASIK, subtypes of LASIK, smile LASIK, epi LASIK. These are laser treatments of the cornea we'll talk about. And then we'll also talk more about the lens treatment. So CLR, custom lens replacement, as well as EVO ICL, the internal permanent contact lens. And so, so Sharif, I guess you put up a slide. So is that my cue to tell about the slide?
It is. Talk about what happens with vision.
Okay. So this is a slide maybe you've seen before, like in a 6th grade science class, but it shows light is coming in on the left hand of the slide, entering the cornea, the front part of the eye. That's where people put on their contact lenses. Next, light passes through the lens. And Sharif, you can put your cursor there on where the lens is. I guess it points to it. And then what's important is all the focusing apparatus of the eye focus light on the retina. And then the image is perceived as vision. And so for years, if somebody didn't have good focused light coming into their eye, they might be nearsighted, farsighted, or astigmatism. they would wear glasses or contacts so that they could see clearly. And we refer to this as vision correction 1.0, and it's just simple glasses or contacts so people could see. Most people on the call that's what they do each day. And then over the years, in about the mid 90s, laser vision correction was approved by the FDA. And these are kind of the most early versions of laser vision correction, like the first prototypes of LASIK. And LASIK is a laser treatment where we can reshape the front of the eye of the cornea. And that's a way to use laser to reshape the cornea and put all light focus on the retina so people don't need glasses or contacts. In fact, that's how I had my vision fixed 25 years ago with LASIK in this office, a long time ago. And then nowadays we'll be talking about modern vision correction. And this is the kind of the most modern version of all the types of procedures we do. Modern LASIK, epi-LASIK SMILE, the lens treatments, CLR, and EVO ICL. They're all procedures that put light focus on the retina, but we refer to modern vision correction as vision correction 3.0, okay?
That's right. And Dr. Bindi, before you talk about what happens in this view of what the patient experiences, I just want to say, if you've got a question, use the question button to ask it. You can submit questions. We're answering the common ones on this webinar, but if your question doesn't get answered directly today, we will follow up with you via email. We'll make sure every single question that's asked by every person's answered. All we ask is that if you came on an anonymous, you need to put your email in with the question so that we can answer it for you. Dr. Bindi, please proceed.
Okay, so most people have heard of LASIK, but this is a laser we use every time we do LASIK. And so the picture on the left, imagine when a person has LASIK, their eyes are numb with eye drops, and we give a pill of Valium if people are anxious beforehand. Most people accept the Valium when offered. And then they walk into the room, they lay on that bed for about 15 minutes to complete both eyes. From a patient's perspective, imagine if you were laying on that bed and you were looking straight up, what the patient would see is what the picture you see on the left. And so during the laser treatment, you'll see a green light flashing. And so I tell my patients to look in the direction of the green light. Most treatments take about 10 to 20 seconds max. And while the patient is looking at the green light, the laser reshapes the cornea and fixes the prescription so people don't need to wear prescription glasses or contacts. A very common question people ask me is, what would happen if I move during the surgery, or my eye moves, or what if I blink? And so while a patient is looking at the green light, the laser is actually able to track eye movements. It auto tracks 1,000 times per second. So if somebody moves or looks away, the laser stays aligned, or if they move a lot, it pauses until they get back into position. And there's a little instrument that keeps people from blinking. So if someone blinks or moves, it doesn't affect the results. And so right now we're just talking about laser treatments, but the thought is people walk into a laser room, they're in the room 15 minutes, we have them arrange for a ride home, and they're on Valium and a little blurry, and it heals up overnight. So the next day people can resume normal activities. And modern LASIK epi-LASIK SMILE works amazingly well. One of the things we'll talk about today is it's not for everybody though. Sometimes we'll meet people and let's say their corneas are a little bit thin, or the prescription's quite large, or they might have different scenarios, their lenses changing with age. And then we might say maybe a different treatment like the EVO ICL. So EVO ICL we're going to talk about as well. It's an alternative to modern LASIK. And this is something that Dr. Kosha can talk about because he had this procedure done on his own eyes, so he knows it quite well.
Yeah, welcome, Dr. Kosha. Great to have you in between clinic in Pleasanton today. And if you would, tell us a little bit about this incredible technology, this EVO ICL.
Yeah, thank you so much, Sharif, and Dr. Bindi for the warm introduction and welcome. The EVO ICL is a fantastic procedure at correcting nearsightedness and astigmatism, which honestly, the vast majority of patients who come in have one or a combination thereof. And this is you can think of it as like a contact lens that goes inside of your eye, behind the iris, the colored portion of your eye. And it stays there correcting your vision. The benefits of it are we can use this for patients who have very high prescriptions, maybe prescriptions that are not amenable to treatment with laser vision. We can also use it if their cornea or certain aspects of their anatomy is not as conducive to a laser vision treatment. So those are some big advantages, and it is reversible. So we can always remove the EVO ICL if needed. And the EVO ICL, as it sits in your eye, is completely without perception to you. So you don't have any sensation of pain, any sensation that the lens is there. I think a lot of patients often ask me, hey, when I put my contact lenses on, I can feel them. It feels gritty, it feels dry. I feel like at the end of the day, it doesn't sit just correctly. So all of these things are solved with the EVO ICL because it's not actually sitting on the surface of your eye, it's inside, and so you don't have any of those sensations. So you can't see it, you can't feel it, but you just wake up and see. So it works really well.
So, Dr. Koshik, I've heard you speak to patients directly about this, and I've heard you say that it's kind of like having a contact lens, but you don't have to maintain it, right?
Mhm.
Is that a fair assessment?
I think that's a great assessment. Yeah.
Great. And as Dr. Bindi said, you've had this procedure yourself, as well as, I guess, not I guess, I know 5 of our staff members, including 3 doctors, have had the EVO ICL. So we can vouch for this being an incredible procedure. Let's move now to a different, let's talk about the lens and transition from these procedures that are appropriate for people that are 18 to 45, right? If we talk about LASIK and we talk about EVO ICL, both equally wonderful. But let's go back into anatomy, and I'd like you, Dr. Koshik, just to take us on a little journey about the lens, and I will bring up the flexing lens. So please start.
Sure, yeah. So if we look at this this diagram, we can see the lens. That's called the crystalline lens. This is what everyone is born with. And this lens, it does a fantastic job, as shown in this animation, of changing its size and shape. So that fluid change is what allows you to bring in objects into focus very quickly from distance to up close. So if you're watching a TV screen and then you're quickly switching over to looking at a cell phone or a book, the lens shape and change is what allows that focus to come into play. But we know that with normal process of aging that we have issues with that lens. The lens actually becomes a little more dysfunctional. It doesn't want to change as well. It becomes a little stiffer, and it basically isn't working as well as it did when you were in your 20s or 30s. So when we talk about vision correction options like LASIK or laser vision correction or EVO ICL, those do a phenomenal job when the lens is still working very well. And when the lens doesn't start working that well, typically in your 50s and there's lens related issues, something we call dysfunctional lens syndrome, then we start thinking about other procedures that can fix your vision and also address distance vision, intermediate vision, and near vision. And that would be something like a custom lens replacement, getting to the root of the problem, which is the aging lens, the dysfunctional lens, removing it, replacing it with an artificial lens that does not degrade, it does not change with time or form a cataract like your natural lens would. So that's another big benefit of doing a custom lens replacement is we're solving multiple issues. We're solving distance vision, near vision, and we're eliminating the future prospect of a cataract.
That's great. And what are these little things? You see this on a fingertip. So let's talk about what an IOL is, please.
Yeah, so these are various different types of intraocular lenses. So when we take that dysfunctional lens out of your eye, we're actually left with a multitude of options that we can then use to put inside your eye, a new artificial lens, like I mentioned before. These come in different powers, these come in different brands and makes, and they each have capabilities that are unique to them. Some help you give a whole range of vision, some help you give just really good distance vision. And so this is something that we take a lot of pride in understanding how they work very well and matching that technology to your anatomy, your eye, your visual goals. So we really want to pair the right technology with the right patient. And that's what we do so well in picking these type of intraocular lenses to help you see well.
And there's a question on here that someone said, hey, I had LASIK a number of years ago. Would I be able to have custom lens replacement later in life?
Yes, that's a question that we hear a lot is I've had LASIK or I've had EVO and I need my vision corrected now many, many years later. Can I have this custom lens replacement done? And the answer is yes. We would be happy to see you and see if you're a great candidate for a custom lens replacement.
Great,
You know, that's
great.
actually a common scenario, Sharif, and even the people on this call right now, there are several people who I personally did LASIK on maybe 15, 20 years ago. And the surgery back then, it was good at fixing distance vision. And then as they got older, their lens became less flexible, like Dr. Koshik was talking about. Their near vision probably got a little worse. And often they'll say, I had LASIK, but now I'm noticing my near vision's worse. Can that be fixed? And the answer is yes. There are a couple different ways it could be fixed. Sometimes just doing a laser treatment to fine tune things can make sense, and we can just fine tune with the laser. There are other patients, it's kind of a common scenario where people come back in their 50s or 60s and they just want to get out of the readers and bifocals. And that's where we talk about these lens treatments. And often in that scenario, it's the light adjustable lens.
That's great. And I'm gonna just put a couple questions that are coming in real time. Dr. Koshik, when you have CLR, do you need to look down to see up close and look up to see at distance the way you do with progressives? Does the IOL flex the way a young person's natural lens does?
Yeah, this is a great question. Something that a lot of patients ask me because you're familiar with your bifocals or you're familiar with your progressive glasses, and that's kind of what you're used to. You're trying to find that sweet spot with your eye to help bring things into focus. But the short answer is no, you don't have to worry about that. With these intraocular lenses, they present that light to you, and your brain interprets all that information real time in the fly. And so you're not trying to navigate through a sweet spot, if you will. You're not having to move your eye into a certain position to be able to then readjust for near vision. It's just working kind of seamlessly. You don't have to think about it. So I think that's a great benefit to these intraocular lenses at getting you out of progressives and not having to deal with that annoyance.
Great, great. And keep asking these questions. It's great. If we don't get to them during the call, we will answer every single one of them. Dr. Bindi, back to you. I'm going to put up on the screen and ask you to answer, where people want to know, where do you do these procedures? Do you have to go to a hospital?
Got it. So as you look at these two rooms, these are different rooms. The picture on the left, that's our laser room. So when people have LASIK, they come into the room on the left. The one on the right, we refer to that as lensopolis in our building, but these are completely in our office. So everything that we do from the initial consultation, the actual surgery, and all the follow-up is done in our office in San Jose or office in Pleasanton. So it's completely self-contained. And just to kind of envision how this process unfolds, on the day of the surgery, people are usually at our office maybe an hour and a half or so. They walk into either of these rooms for about 15 or 20 minutes. These are procedures that they're outpatient procedures. So after the procedure, they need someone to drive them home. And there's no hospital, there's no outside clinic. It's done with our team, our staff. And we only do modern vision correction. So we don't do glaucoma surgeries, retinal surgeries. We don't do knee replacements or anything like an ambulatory surgical center. We do modern vision correction. And so on the left, that's a patient, I guess I just did surgery. Well, that was about 6 months ago. There were also 10 other people who woke up this morning fumbling for their glasses. They walked into that room this morning and they've already been fixed this morning. We have more to go this afternoon. And then on the left, that's Dr. Ling with one of his patients, right, shortly after she had CLR.
Yeah. Yeah. And I mean, people are always asking, well, are you put under, are you put under general anesthesia? None of that. In fact, every patient, as we know, is alert, awake, and the doctor, the surgeon, and the patient are having a conversation. We'll put on the music of your choice. We really try to make this an incredible experience. And Dr. Bindi, what was it about that made you want us to offer lens procedures like the ICL and CLR to make it like LASIK?
Well, for the last couple of decades, we would see people who had LASIK and they would talk about how quick, easy, painless, and amazing it was. It was so easy to get through. And then we'd hear other people who did procedures in a hospital and they might have cataract surgery or something like this. And they described it like a totally different process. And working with Dr. Koshik and Dr. Ling and Sharif as well, who helps with our patient experience, we said, let's make CLR and EVO ICL a LASIK-like experience. And so it's interesting. If you spoke to a person after they had LASIK or EVO or CLR, and you listen to the way the terms that they use to describe it, they actually would use the exact same terms. They would say the procedure takes about 15 to 20 minutes to complete. It doesn't hurt. And within a day or two, they're kind of back to normal. So these are kind of overlapping patient experiences. And we just pick the procedure that's most appropriate for the person. And if we see somebody who's in their 20s, 30s, early 40s, and sometimes up into the 50s, often laser treatment is the treatment of choice. If somebody has a huge prescription or thin corneas, we might have that person pivot a little bit more to an EVO ICL. And then also when we see somebody in their later 50s, 60s, and 70s, we start to say, well, maybe a lens treatment like CLR is even the most appropriate thing. And so that's where during the consultation, we meet with our patients. They come to our office. They spend time taking a whole host of measurements. We call this the advanced vision analysis. And in that time, over a million data points are gathered. I guess Sharif is showing the advanced vision analysis. And it's a coterie of tests that we take about corneal thickness, corneal shape, the prescription, the health of the eyes, health of the retina, not just a routine eye exam. It's our advanced vision analysis to see if is it appropriate to do a laser treatment, better to do EVO ICL or CLR. And then Dr. Koshik, Dr. Ling, and I, we meet firsthand with the patient to amount of time they spend with us, they leave knowing they have a firm suggestion of what's going to work well. Also, about 80% of the time, a laser treatment or a lens treatment is appropriate. Also, about 20% of the time, we say it's actually preferable to do nothing and just stick with glasses or contacts. And so this is a safety first kind of a scenario here where if it's going to work great, we say this is the option. And a lot of people will say just stick with glasses or contacts. That's just safe. And even though I've done about 75,000 surgeries, I've also told almost 15,000 people to not do a procedure. And so that's what we do during the consultation. We offer conservative advice about which procedure is going to be the best for them or nothing at all.
Dr. Koshik, would you just comment briefly on likely, things that they can expect like the day after surgery in terms of healing and maybe even what some common side effects?
Yeah, so I think just speaking very commonly to all the different modern vision corrective procedures that we perform, I expect patients the next day to see so much better than they did walking into our clinic the day before. Things that you might experience still just that one day visit is a little bit of dryness. I think that's pretty common. Patients might have that slight kind of gritty sensation. Artificial tears really help with that. And they might be a little bit light sensitive because now you just have this procedure done and possibly you're still a little bit dilated depending on the type of procedure that you had done. And so you can be a little bit light sensitive there. But patients rapidly notice that their vision improves even on day one. And I would say, even very conservatively, probably like 95% or higher, and Dr. Bindi can chime in on this, of patients the next day drive themselves into their postoperative visit because the vision's that good the next day.
Yeah.
Yeah. So we tell people they should be fine the next day to resume all their normal activities. People are surprised the very next day when they drive to their appointment. We'll see our patients, surgery patients today, we'll see them tomorrow. And they come in, they go, is it legal that I drove here? And we go, well, you can see 20/20. So the answer is yes, they can drive the next day. And so these procedures, there's no injections or blood or blades it's just a different, these are laser treatments and lens treatments. So these are quite simple to get through and the recovery is accordingly very quick.
And we invite family members or friends, if you have them with you, they can watch the procedure right outside the room. So that's fine. We were asking, and people have been putting questions in the chat, which we won't be able to see once we end this. So if you have a lengthy question, please copy it and paste it into the question box so we can make sure we get back to you. There's questions about how long will this last? Right? Is this permanent? And, this gets into your discussion about lens changes later on, but Dr. Bindi, could you just summarize, the LASIK and the
Sure.
transition into lens? Thank you.
So, so I tell people when someone does LASIK, we treat all the prescription, nearsightedness, farsightedness, or astigmatism. We can set someone to be 20/20. And I make the analogy, let's say today someone got a brand new pair of glasses and they said, how long will that pair of glasses perfect their vision over the next 10, 20, 30 years. And I say, it's just like getting a new pair of glasses. We set it to be perfect. It's not uncommon at all if someone does laser treatment and they come back 15, 20 years later just to fine tune things a little bit, get it back up to 20/20. Again, I had mine 25 years ago and I can still see clear, but I've slipped a little bit in one of my eyes and I could do a touch up if it continues to drift. But as people get older, as they move through their 50s and 60s, we just say anticipate as the lens gets less flexible, people will start to eventually need reading glasses if they do a laser treatment. And sometimes we'll make an age adjustment. We'll leave a little bit of nearsightedness, and that makes it more comfortable for people to read as they move through their 40s, 50s, and 60s, just so they don't need reading glasses. And then that's right to the heart of the matter. When we see somebody who's already in their 50s or 60s, we might talk about a lens treatment that might have an advantage because remember, it can fix distance vision and near vision, and it fixes the aging part of the eye. The lens is replaced with that lens implant, and then people don't need to use reading glasses. They never get cataracts, and that's why that's one and done.
Great. Well, it's wonderful to have Dr. Ling be able to join us after he finished his morning cases as well. Joe, welcome. And I'm just going to pose a question to you because I'm seeing it come up. Would you talk about dry eye and what we do kind of pre-operatively to help the patient manage if they have dry eye conditions and what they could expect post-operatively?
Yes, absolutely. Thanks, Sharif. Hi, everyone. So I would love to answer that question. So dry eyes is a very common condition, especially here in the Bay Area. Dry is a form of wear and tear on our eyes in terms of both usage and environmental causes, as well as age-related causes. So it's multifactorial. Our eyes are meant to be moist. We create tears to lubricate our eyes, and we require the moisture to be able to see well, feel well, and have any sort of quick recovery process as well in case our eyes go through a procedure. So dry eye care is very important. We assess that in detail for each individual that comes into our clinic. So things that can make dry eye worse would include, screen use. So here in the Bay Area, we have a lot of software engineers. In general, we use our phones and read a lot these days. That causes us to reduce our blink reflex and increase the amount of dry eyes that we get and feel. There's also the humidity that we subjugate our eyes to in our environment. So in the Bay Area, we're pretty much in the desert, low humidity, that takes moisture out of our eyes. And over time, through age, we produce less tears as well. So when you come in for a consultation and evaluation, we'll look at the current status, put you on the right therapy of artificial tears, which is the first line, ointments, and some common habits to have put in place, or we can, continue to increase the level of therapy to make sure that you're a good candidate for vision correction.
Thank you, Dr. Ling. I appreciate that. I'm going to just put some slides back up as well. And let me go to full screen. I wanted to show everyone that we'd mentioned this earlier, but all of our surgeons have had a procedure, and the majority of our team members that support surgery, whatever their role, we believe in this so strongly. We've had it done. I had epi LASIK now 30 years ago. Renee, who's taking notes in the background, had custom lens replacement with Dr. Ling about 2 years ago. So we're patients as well. And we know exactly what everyone goes through because we've been through it ourselves. And there are a lot of questions that are coming on about, do I need to come in for an appointment, or my optometrist did measurements? Do I need to redo them with you? Absolutely. We're going to do all the measurements, that advanced vision analysis. And there's really the next step is for you to set up a consultation. If you know you're ready, I want to have this done as long as I'm a candidate. Well, you can just go right to our website, or you can contact us by phone and set up an appointment in either our San Jose or Pleasanton location. If you're a person that you're not really sure, you want to learn a little more about it, you'd like to have a Zoom or phone consultation virtually from your home or office, we can do that as well. You can schedule that. And if you really just want to talk about price and understand our fees, yes, let's fill out that form on our website, and we'll be glad to have a phone call with you and do a virtual consultation. But as Dr. Bindi said, a financial consultation, just talk about fees. But as Dr. Bindi had said earlier, there is no substitute for this advanced vision analysis. Many patients tell us it is the best eye exam they've ever had in their life. And we need to be thorough to make sure that you are a candidate and that you could join this wall of fame, if you will, of just a small sampling of our patients that all wore glasses until they didn't. Dr. Bindi, any kind of additional thoughts or things that we need to cover in this part of the webinar?
Well, I for sure think it's good. Afterward, we're going to do the after party. So if people have some specific questions that they just want to be able to voice and get it out there, we're so lucky Dr. Koshik has volunteered to do that this time. And I do have to get ready because I'm getting ready. We have surgeries this afternoon. I just wanted to say thank you very much for taking time out of your day. And I look forward to meeting you in person when the time is right, if that's something that you want to look into. Okay. And to all my previous patients, thanks for being back at the Laser Eye Center. All right, bye, you guys. Thank you very much.
Thank you, Dr. Bindi. And one topic that we promised we'd cover on this is, does insurance cover these procedures? And these are considered refractive procedures. Dr. Lang, why don't you just talk about that difference between refractive surgery and kind of disease-based surgery?
Yeah, so here at the Laser Eye Center, we are hyper-focused on refractive surgery. And what is refractive surgery? It's essentially correcting the focus of the eye. And if we boil down even more, essentially it's helping people get out of glasses, because that's typically the reason we wear glasses for, is to align the focus through the eyes. And I'm sure you guys already gone through kind of the basic physiology of it, but we are a practice in which we're all trained to perform the full range of vision correction. That includes, laser vision correction, lens replacements, ICLs. So when you come and step in through, our doors here, you're getting the full evaluation of whether something is a potential or not. We're going to establish candidacy or not. Not every person that walks in through the door walks out with the procedure, but if you are recommended a procedure, that means that we are very confident that you're going to be very happy with the procedure that we recommended for you. So it's all about coming in to get looked at. We have an amazing team of specialists, and it's not just any one individual, it's the whole practice and the individuals that create such a great experience for our patients. So as Dr. Bindi said, I look forward to meeting each and every one of you that's interested in getting out of glasses.
Got it. And just to review pricing, because people want to know what the fees are. For laser vision correction, it's $300 to $3,500 per eye. For the EVO ICL, it's just under $5,000 per eye. And for custom lens replacement, it's either $7,000 to $8,000 per eye. We do offer no interest financing that breaks up these payments over 24 months. And I did some rough calculations for LASIK. That's going to be under $300 for both eyes. For the EVO ICL, it's going to be just under, I think, $400. And for CLR, it could be just under $600 or just over $600, depending on whether or not you need the light adjustable lens. That's a lens choice we would discuss with you during your consultation. But those are the fees to have it. And we'll work and show you. Our counselors are very good at showing patients how this actually makes economic sense to have this procedure when you think about how much money is spent each year by people on glasses and contact lenses and ongoing eye exams to check prescription. There's an absolute financial case to be made for having laser vision correction, the EVO ICL, or custom lens replacement, depending on what's most appropriate for you. What we're going to do right now is we're going to just formally end the webinar. I will say before that, if you typed in a question and you were anonymous, we didn't answer it, please kind of copy it, do it again, and add your email address, because that's the only way that Renee can get back to you and send you an answer. And we want to make sure that we answer every single question that gets asked. Dr. Koshik and I are going to stay on for a little bit longer once I end the webinar and stop recording it, and we will answer questions until he has to go. Dr. Ling, I don't know your schedule. I know you just had a brief break with all the lens patients that you're treating today.
Yeah, and we have another session starting in about 30 minutes. So
okay.
A little rest. It was great for everyone to attend today. Enjoy the after party.
Great.
And I'll see everyone in the future.
Okay. Thank you, Dr. Lang. And those of you that are still on, as long as we're on the webinar, you can submit your questions. I'll be looking at some of them as well. I'm going to stop sharing right now. And I'm also just going to pause recording because we'll just take these as we are. Actually, let's just keep recording. We'll have these. It'll end up being available for people to see. We will post this webinar to our website. It takes us a couple days to get it all done, but by Tuesday, you should be getting a notification from us via text with a link right to the webinar. You can watch it again. You can share it with other people to watch and learn about everything that we discussed around modern vision correction. So Dr. Koshik, you and I are both looking at the webinar chat, and
Mhm.
okay, I see one here from Rosa. Would someone who suffers from chronic dry eye be ruled out for having a procedure?
Yeah, it's a good question. So, the best part of our advanced vision analysis, like Sharif mentioned, is we are comprehensively looking at your eye and we're identifying anything that would prevent you from having the best possible vision after a procedure. So, we do procedures on patients who have dry eyes, but we want to make sure that the dry eye is well managed before we do that procedure. So, if you deal with dry eyes, we would identify it. We would put you on a treatment regimen to improve your dry eyes. And then only once we feel like everything is safe and the dryness is resolved, would we then say, yeah, let's go forward with a procedure that'll help you see better.
A lot of questions about, am I a candidate if I had keratoconus, if I had a retinal tear, if we talked about dry eyes a minute ago. I mean, it's impossible, right, on a webinar to diagnose that way. But what's your general commentary on that for patients?
Yeah, so generally, because all of those kind of things are very unique and it has to do with how is it affecting your vision, what degree of that condition do you have? Is it very mild or is this something very serious? Because of that nature, I think the true answer is we have these amazing consultations that are of no charge. Come in, get a full comprehensive eye exam from a wonderful team, and then we'll be able to accurately say, yes, this is something that we can do for you. Or if we can't, like Dr. Bindi mentioned earlier, 20% of patients we tell, hey, I don't think this is a great option right now. Let's reevaluate in the future.
Got it. Got it. People are asking, is there a cost for the advanced vision analysis? And I'll just take that no. We did not want to create a barrier to this life-changing potential. We don't. We could charge. If you were to add up the cost of doing all the tests, it's well over $300 is what you would pay for that. We don't do that. That's our commitment to the community to help people understand what's going on with their vision and get really a very thorough eye exam. I see GP has raised his hand, but GP, I can't do that. Please put your question in the Q&A and we'll do our best to answer it there. So no, we do not charge for that. And then another one, Courtney, thank you so much. Really scary because my vision is very poor. She's a -9 myope. Can we do EVO ICL on a -9? Dr. Koch?
Yes, we can definitely do EVO on a -9. Both Dr. Ling and myself have done EVO on prescriptions that are even larger than that. I've done -18. So we have the capability to treat a wide variety of nearsightedness.
And the anonymous attendee who said, are these the same doctors who do the procedures or are there others? No, you've met all three of our surgeons here who perform highly skilled, world-class specialists who only do modern vision correction. Javier says he's very interested. Thank you. And I'm going to make an appointment. Yes, please do. You can do that on our website or you can call us 408-984-1010 or the toll free is 877-GET-2020. That's what you hear if you hear the radio commercials that go on. But yes, we have a team of people. We'll be happy to find a convenient appointment for you either in San Jose or in Pleasanton. Some specific, 60-year-old male with long-standing keratoconus, can ICL be done without cross-linking first? So remember, Dr. Koshik, 60-year-old male.
Yeah, so I mean, just based off of the age, I have to think that the lens is being affected at this point, just statistically speaking. And so likely ICL might not be the best option for you. It might actually end up being something like a custom lens replacement. But that's something we would look to deeply with our advanced vision analysis and give you the best possible recommendation.
Yes. Kathleen, absolutely. You can use your FSA or HSA funds for any of the procedures that we do. People are asking about dry eye again, this question is, I had LASIK a long time ago and my eyes water a lot. Am I still a candidate? And how do you answer that?
Yeah, so still a candidate, still options that we have to improve your vision. If you've had LASIK a while ago, likely probably would not repeat LASIK, but there are other options available to you. And so we would address both the dryness, the watering, and then whatever kind of visual complaints that you have.
Got it. Shayna's asking a two-part question. The first part, I'll answer. How long have you been doing EVO or CLR procedures? We started our lens program 4 years ago, and we've quickly emerged as really the top practice in the San Francisco Bay Area. And the reason is because it's the only thing we do. And I think that one of the differences about Laser Eye Center of Silicon Valley is because our surgeons and our entire team are focused on modern vision correction. We sacrifice the ability to treat glaucoma or retina or dry eye, which are all very important things that need to be treated. And you'll find general ophthalmology practices or comprehensive of them that have subspecialists that do all of them. That's wonderful. It's just not what we chose to do. We just chose to do one thing and do it exceptionally well. And then I'll leave this one for you, Dr. Koshik. How long has CLR been approved in the US? Let's talk about that.
Yeah. So yeah, I think if we talk about a custom lens replacement, we really have to talk about how long has a lens or a cataract in the eye been removed. And I mean, we can go back decades and decades for lens-based surgery. I mean, the first done in modern history is 1949. So we're talking about over 70 years of wonderful experience. And then on top of that, with the technology that we use to do a custom lens replacement now, having only gotten better and better, you're looking at well-proven results for over 20, 30 years doing these type of highly sophisticated custom lens replacements.
Yeah, one thing it's hard for patients to appreciate is how the lens technology has evolved so much, particularly in the last 5 to 10 years. And our surgeons take a lot of pride about matching the technology to both the goals and let's call it the anatomy of the patient. That's something that you take very seriously. We did have a question about what is the light adjustable lens. So why don't you just take a minute and just kind of briefly describe that?
Yeah, so the light adjustable lens is an intraocular lens that I put into the eye after during a custom lens replacement. Typically, that lens is used most often in patients who have had previous laser vision correction, like LASIK. And it's the only lens that we can change the prescription of that lens in your eye without doing another surgery or procedure. We can just use light, hence the light adjustable. We can just use light to change that prescription and do that in the matter of 60 seconds in a simple clinic visit to get you the vision that you want. And fine tune your vision. So oftentimes patients who have had LASIK in the past are great candidates for a custom lens replacement, and we will utilize the light adjustable lens technology to give you that perfect vision that you want.
And of course, when someone has had laser vision correction, LASIK, or even RK in the past,
Yeah.
Dr. Koshik will only do the light adjustable lens, correct?
Yes, that is the preferred, and to give you the patient the best possible result.
Got it. Pauline asked, I heard the halo light effect is pretty bad after CLR. Comment, please.
Yeah, so I mean, this is a question I hear from a lot of patients too. Once again, it kind of comes back to your eye anatomy, your eye health, something that we will screen very carefully to make sure, hey, are you at risk for this? Is this something that could be possible for you? And also the type of lens that we put inside the eye. So we line those two up. So we look at your anatomy, we look at what lens would work best for it to minimize or even eliminate, in some cases completely, any possibility of that happening. It just really all depends on the technology we're using and the anatomy of your eye.
And some patients are asking, can only one eye be done? And the answer is?
The answer is yes. Yeah,
for all our procedures, correct?
Yeah, for all of our procedures. And once again, that's the most important thing. I think if you ask Dr. Ling and you ask Dr. Bindi and you ask myself, we all love doing surgery. We would want to do it all day if we could. But we also know when to do surgery and when not to do surgery. So if you can get the vision that you want by just doing surgery in one eye, that is something that we would present to you and be able to do that.
Zara is asking a question, are there any complications at all? Right? Which is a loaded question. Because this is surgery, but Dr. Koshik, let's start with you and then I might add in.
Yeah. So, I mean, I think, Sharif, you hit the nail on the head. I think any honest, ethical person would say, yes, there's always a possibility, right? It's medicine. But when we talk about the different procedures that we do, whether it's laser vision correction, EVO ICL, or a custom lens replacement, and we look at your anatomy, we are very cognizant of what are the potential risks for that patient with that type of procedure. And we're only going to recommend it if we feel like this is the least possible risk for this patient and the best possible vision. And so going back once again to what Dr. Bindi said, where we eliminate 20% of the patients that we see because they are not good candidates, that means the 80% that we leave and say, yes, you are a good candidate, it's because we have identified that your risk is incredibly low. and we would talk to you about that. And so that's why those patients, the 80% we actually sign up for surgery, do so well. They come out, they love it, they love their vision, and they're not dealing with these kind of complications.
And our entire process, our facility is designed safety first, right? Of
Mhm.
course, the recommendation of the surgeon to either do or not do a procedure, but safety first, everything that we do in an environment that we fully control and maintain. Many other practices that don't invest in that facility have to take a patient somewhere else. And we didn't do it that way because we wanted to make sure that the people you meet during your consultation are the same ones and the same staff to support the surgeon during your procedure. And that's worked out very, very well for us. Another question that came about, what's the minimum age? So would you talk about the age range mainly for, the 18 to 45 and then the kind of 45 and
Yeah.
above?
Yeah, so definitely 18 years of age to about 45 is classically what we see a lot of laser vision correction. So things like Smile LASIK, all laser LASIK, Epi LASIK, and EVO ICL. I think once you get past that, especially 50s and onward, we're looking more to a custom lens replacement. And so that's the kind of distinction we have. There's always going to be exceptions to that general rule. There are patients that are great candidates for a laser vision correction and they're 50 years old. And there are patients that are 45 years old. So it really all depends, but those are the general guidelines, 18 to 45 for laser vision correction and EVO ICL, and then 45 onwards for more of a custom lens replacement.
I'm looking at just some of the questions here that just kind of continue to come up. And I think we've covered a lot of them. I mean, I'll just put one on. I have a dry eye and astigmatism, and now I got cataracts. Can you fix me?
Yeah, yes, we can definitely fix astigmatism. We can fix the cataract, and then the dry eye we can treat with medication. So that's something that we would kind of put as part of our treatment plan with you. But yes, all three of those things are very fixable.
Yeah, and this is one I'm going to try to summarize. It came in, anonymous. I had LASIK 15 years ago for my nearsightedness and astigmatism. Since then, I've been fine, except now I'm 55 and I need readers to read labels and other items.
Mhm.
Is my only option the lens implant or replacement? Is there no laser option? By the way, the dramatic is mine, okay? Maybe not the
Yes.
patient. Custom lens replacement needs to place a lens on the eye, and I would prefer a laser procedure, but I'm not sure that's an option. So let's
Yes.
help guide this patient.
Of course, yeah. So, given just a recap, 55 years of age, LASIK 15 years ago, noticing a little bit of issues with reading up near. And it all comes down to best quality vision and how long do you want that vision to last. And so, by doing a lens replacement, I know that you're going to have that improvement in vision for the rest of your life. That lens is going to give you that vision that you want, and it's not going to change. Your prescription's not going to change, and you won't develop a cataract. So really, yes, a custom lens replacement would be the most definitive solution for you at treating that prescription. Now, that being said, we'll do the comprehensive analysis, and if there's a way that we could get you more time with a laser vision enhancement, that's something we could consider. But I'd say most patients want to come in, have a great procedure, and then not kind of deal with it, just be kind of done. And so that's why a custom lens replacement would work really well for you.
Maria is asking, what about people over 80? Is 80 too old, Dr. Koshik?
80 is not too old. Both Dr. Ling, myself, we've done lens replacement or cataract surgery on patients who are 80 and older. So definitely age is not a limit. Definitely want to get you seeing as well as you possibly can, as soon as you possibly can, so that you can enjoy your vision.
Yes, yes. Is the lens synthetic that gets implanted?
So the lens is an artificial lens, and they come with different type of materials. So it depends on the type of lens. I'd say most commonly the lenses that we are utilizing are made out of either acrylic or silicone, and these are completely inert in your eye. Your body cannot have a rejection to it. Your body cannot kind of have a response to it that is negative. And they've been well studied in the human eye for years.
Got it. Let's just, while we're on this theme of people, who've had LASIK and then they're noticing a decline in vision, could you just reiterate that, it's not that your LASIK wore off, it's that there's lens changes?
Exactly. Yeah. So we have to think back to that diagram of the eye. The lens is inside your eye. That lens nicely adjusts its shape and size when you're in your 20s, your 30s, and even early 40s. But as you get into the mid 40s and 50s, that lens is becoming a little more rigid, inflexible, and the quality of the vision through that lens is also suffering. It's starting to cloud. It's starting to develop changes to its translucent nature, and so that's what's causing your vision to slip, especially if you've had LASIK, let's say 15 or 20 years ago. It's that lens changing, and so your prescription's coming up because the lens has changed.
Thank you. And, you know, there's some more questions about, Flora asked a question about cost. And so I had said that LASIK for both eyes on a 24-month, no interest plan would be just under, somewhat under $300 a month. And then you're done. Compared to spending hundreds and hundreds of dollars every year on glasses, contacts, and exams, we think this is actually a very, very wise investment. And then also it could be lower if you went on a longer term, like a 60-month payment plan. But, you know, in my analysis of this, the 24-month no interest is a better deal for the consumer. So if you can qualify for that, you should get that. And we're happy to help you through that process. We have 3 different banks, if you will, that are on our website that you can go and get pre-approved, or, you know, reach out to us, and or one of our financial counselors will help you, walk you through that process. I also see Nathan had asked a question about, you know, not going to the gym, and, you know, just kind of, and he does, looks like Nathan does daily work requires heavy lifting or physical contact. So how long would you want them kind of on the sidelines, Dr. Koshik, before they got back in to doing that?
Yeah, when we're talking about heavy lifting, and I kind of just do a general cutoff at, let's say, if you're lifting more than 15 pounds, I would say after a custom lens replacement or EVO ICL, refrain from that type of lifting for 1 week. And we reevaluate you at that 1 week mark just to see how the eyes are doing, making sure everything's healing well, and then you can kind of resume those kind of normal activities. But just for clarification, we've done these type of surgeries on power lifters, bodybuilders, extreme athletes that do marathons, triathlons, these kind of, you know, very intense, physically demanding activities, and they do just great. It's just that first week you might need to take it a little easy.
Yeah. So in other professions, I know you've treated police officers and marksmen, and the gentleman who came in recently, and it was was it crossbow? He was an
Yes.
archery
Yeah.
person. Archery is and he competed in archery.
Mhm.
So how are they doing?
Yeah, exactly. So these patients are doing great. I mean, we just had, like Sharif mentioned, a police officer very recently that we did, who is now seeing very well without glasses and contact lenses, both at distance and at near. And so even these other athletes, as you mentioned, are doing very well. So everything comes down to that evaluation, how comprehensive we are in doing that evaluation, and then pairing that right technology for that patient.
Right. Some of the things that we covered earlier, but people have come on late, and, you know, can you describe the CLR procedure? Jeanette, we can't do it justice during this call, but everyone is going to receive a link to the webinar. So you'll be able to watch the whole thing from start to finish and get your questions answered. And of course, we can also talk about that in a virtual or in-person consultation. Ahmad's asking about, do we accept medical insurance? The answer is no. And we talked about that earlier, that this is, refractive surgery is considered an option because you can always wear glasses or contacts, but this is for people who see value in the investment and don't want the hassle of contacts and glasses and just want to simply wake up and see and get on with their lives. Another question I'll reiterate, is the evaluation consultation free of charge? And the answer is yes. We do not charge for that, and that is by design. This is a highly valuable consultation exam that you have in terms of the thoroughness and just the sheer number of tests we do. And it takes, you're going to be with us an hour and a half, maybe longer. But you know what? That's a good thing. You wouldn't want to rush through an exam of this, especially if you're considering modern vision correction. And it allows our doctors and our surgeons to get all the data they need to understand the health of your eyes and to make the correct recommendation, which could be, don't do anything. Please wait, because it's not appropriate for you. I'm going to go, Bridget's question, is it possible to go to the pool or near fire or heat? Or I saw something about a sauna after the procedure, sauna and steam rooms. Could you just please give some advice on that?
Yeah, so typically for any of the modern vision corrective procedures that we do say to avoid pools or the beach or the lake or the sauna for about 1 week. And that's really just for infection control. Pools and lakes and ponds and the beach, they all have bacteria. and we don't want that type of bacteria anywhere near your eye. So we avoid that for about 1 week.
Got it. Got it. And Dr. Koshik, I'm sad to say we have to call the after party to an end. I know I can tell you're getting called back into clinic. I want to thank everyone for joining us today. Please give us a call. We have our team, our call team is ready to help, 877-GET-2020, or go to our website, 2020eyesight.com, lasereyeclr.com. We have a bunch of different URLs, and we're glad to help you. Thanks so much. Those of you who didn't have your specific questions answered on the call will get an email from Renee, and she'll take care of that for you. Hope you have a great rest of your day and enjoy the weekend. Bye-bye.